I'm a family physician, and so what I like to do is see people all the way from birth until death. I like to see entire families if I can. So newborns, small children, adolescents, young adults, and elderly folks are all part of my practice. I think the most important thing is to be able to communicate well what's going on. So for the patient to leave the office feeling like they were heard and there's a plan for their care going forward. And certainly we don't want to take just diagnoses apart and treat just the diagnosis. We really want to treat the whole person. And so my hope is that we get a sense of wellness for that patient, both physically, psychologically, relationally, in all those areas if we can. While I like the medicine part, the science of being a doctor, the thing I like the most is actually the relationship with my patients. And I think family practice offers the most opportunities to have long-term ongoing relationships with my patients. And so what I really like is to be able to look back over a couple of years and say, I remember when that happened and how we got through that circumstance and how we made this thing better, and knowing people over time and forming a relationship with them. If there's some transfer of care that's needed, if it's a day when I'm not in the office and my colleague might have to step in for me, that all that information would be readily available to that colleague, and there wouldn't be anything that gets dropped in between. Of course, the other things are like, you can actually read it, and you don't have to worry about bad handwriting and those kinds of things, which really does make a difference in the long run, that there won't be any mistakes made because of those kinds of issues that just don't seem to happen with the electronic medical records. Hi, I'm Kathleen Mathey. I'm a family physician here at Family Care Associates, a part of GBMC.